Hi, I'm Dr. Wendy Stock. I'm a professor of medicine at the University of Chicago, where I focus on care of patients with acute leukemias, particularly acute lymphoblastic leukemia. And I've been asked to comment on the rationale for the use of pediatric-based regimens for young adults with ALL. And I think there's quite good rationale, excellent rationale, from a number of sources. As many of you know, years ago, um, a study was done, and multiple studies actually were done, that showed that using a pediatric regimen in compared to an adult, less intensive regimen, potentially in terms of the use of steroids, vincristine, asparaginase, and intrathecal therapy, was beneficial. And then a number of prospective studies now have been done that show, not in a randomized fashion, but the fact that using a pediatric-based regimen in a young adult population, which is defined differently across the globe, but in the United States is typically a population that involves 18 to 39-year-old patients, is significantly better than the historical control data. Recently, a number of multivariate and systematic reviews have been done that demonstrate the benefit of a pediatric-based regimen, that is one that contains the elements that I just described, over other standard adult regimens. The most prominent of which, I hope, is one that is going to be actually published in the next 2 weeks. And it was sponsored by the American Society of Hematology, which asked for a mandate to develop guidelines for treatment of AYA patients with acute lymphoblastic leukemia. And through this very rigorous systematic review that was done over a period of years, we demonstrated a benefit to the use of pediatric-based regimens compared to non-asparaginase-based regimens for young adults with acute lymphoblastic leukemia in this very rigorous multivariate systematic review analysis.